Let's go back to COVID-19. So the pandemic may have caused 15 million deaths globally. This is estimated from the World Health Organization. It says determining the exact number of deaths is challenging because many countries undercount the numbers. The official global death toll reported is 6.2 million. So how much higher are excess deaths than the official COVID-19 deaths? To help us answer that, we're now joined by Dr Samira Asma from the World Health Organization. Thank you so much for your time, Doctor. We do appreciate it. Perhaps just tell us about this report where we could possibly see the death toll from this pandemic being almost 15 million.
Absolutely. WHO published the new estimates of excess mortality yesterday with a staggering 14.9 million excess deaths directly or indirectly associated with the COVID-19 pandemic during the past 24 months, from the beginning in January 2020 to December 2021. And this represents 9.5 million more deaths, or almost 3 times more deaths than were officially reported to WHO.
How did you come to the 14.9 million? Is it just collating all the numbers from the various countries?
There were 2 processes we employed. One was to request all our member states to submit data on deaths for all causes, directly due to COVID and also due to foregone care or any other underlying conditions. And we constituted an expert technical advisory group with the UN Department of Social and Economic Affairs, UNDESA. And this has been a process of 1.5 years. We developed a rigorous methodology and used the best available data to produce the best estimates. And we consulted with all the countries and we resolved any issues, responded to questions. We wanted to make sure that we are coming to the best estimates possible, with the recognition that estimates are a reflection of reality, but not a reality. And there are also significant data gaps in a number of countries. There is a lag in data reporting, or there is just no capacity in collecting life and death information.
Do you maybe have the figures or the information with regards to perhaps some of the countries that have recorded the most deaths because of the COVID-19 pandemic? I'm not sure if you have a top 10 list country or how it exactly works, but do you have some of the top countries that have lost its citizens mostly due to COVID-19?
We can look at the absolute numbers of deaths, and we have reported the top 10 countries that have absolute numbers. But it is also important to look at from another lens of per capita deaths, and it shows how every country has done with regard to their population. So it is just not enough to say what is the absolute count, because it reflects the population, but it is also important to look at per capita. And we have listed both and made the data available on our website at who.int.
I'm wondering if you could maybe give us some perspective as to what happened on the African continent, because many were saying that they were very worried about what would happen with the COVID-19 pandemic on the African continent because of its population size and because many areas were overpopulated. In terms of this death toll that we are now seeing increasing to almost 15 million, how did the African continent fare?
Very important question. What we have seen out of the 14.9 million deaths, majority of deaths that were attributed were for Southeast Asia, followed by Europe and the Americas. The African subcontinent and the Western Pacific region were among the lowest. And yes, there has been less number of deaths in the African subcontinent compared to Southeast Asia, for example. And part of it is that there is an underlying lack of reporting, but also we have seen that from the total, the majority of deaths occurred in men globally, as well as among than women, and also among people of age 60 and over. So there are a couple of reasons why we see low deaths in the African subcontinent, but it is difficult to say definitively why it has been so. And we will continue to update as the pandemic unfolds and update the estimates.
I just want to get clarity on some countries, and I know you've mentioned the fact that it's very difficult to get data and to collate data in some of these countries. But are you concerned about some countries, if any at all, that have not recorded any cause of death among their populations linked to COVID-19? And how did you move into spaces like, for example, or countries, for example, like India, where it's very difficult to get those figures correct because of the population size?
Globally, we have undertaken an assessment as to how many countries are able to report on just deaths alone. 6 out of 10 deaths globally go unregistered or unreported. And when we look at the African subcontinent, 9 out of 10 deaths are not registered. And over 70 countries don't report high quality cause of death. So given this reality, it is difficult to estimate accurately. We need good civil registration and vital statistics systems in every country. And this estimates has also illuminated through COVID lens that there is a lot of work that needs to get done. And we are calling on all governments to invest in good civil registration and vital statistics and cause of death reporting. We have the tools. What we need is political commitment and investment. This is also a sign of good governance and accountability. We need to know births, deaths, and everything in between.
Doctor, maybe we can just end off with a question with regards to moving forward. You have indicated that you will still be collecting data. It's still a process that's underway. But I think the big concern here is if we are going to see this number shifting at all. While we do know that sadly people are still losing their lives due to the COVID-19 pandemic, there's not as much panic anymore because there almost seems to be a grip on this pandemic. But will we be seeing this number increasing when the World Health Organization goes back and tries to collate in countries that perhaps weren't easily accessible?
I think what we are seeing is that many countries are taking a good, making a good response in terms of stopping the effects of COVID-19 and also strengthening their capacity to respond if there is another emergency. We will be updating the estimates as new data becomes available, and there is a lot that is happening. There is vaccination. People are getting more coverage. There are treatments that are available. There are better diagnostics. And while we also recognize that there is a disparity between who has been vaccinated in which countries and where they have not been vaccinated yet. And we also see that there is a risk for variants. So it is a balance, and we hope that with the tools that we have and are proven to work, we hope all governments take it seriously and get the protection to the populations.
Sorry, Doctor, I know I said one last question, but this will be my last question to you. I'm just interested to know whether or not the World Health Organization has been able to ascertain those that have passed on, whether or not they were vaccinated, or if the World Health Organization is able to know whether or not which variant individuals passed on from. Do you have that information?
Unfortunately not, but that's a great question. And that really, again, underscores that we want every country to have robust health information systems. We want every country to have timely, reliable, and actionable data. There is a lot of work that has been done coming especially from South Africa with regard to genomic surveillance. And I think countries are really stepping up and sharing information, and we want that to continue. And hopefully, as good data becomes available, we will be able to have a good count on deaths, on recovery, and also there is a risk of long COVID as well. So, but what we are currently lacking is good data and health information systems.
Certainly. I think long COVID is also something that definitely needs to be explored and studied further. You said something, you said South Africa is doing really well in terms of its genomics, and I must say that our health experts are not very happy with how South Africa was treated when we came out and said that we have found a new variant. But our health experts, of course, still being very kind and sharing all the information. I think at the end of the day, it's about working together and all governments coming together with the World Health Organization to try and get to the bottom of the COVID-19 pandemic. Thank you so much for your time. That was Dr. Samira Asma of the World Health Organization coming to us live from Geneva, Switzerland.